The present and future of spine and neurological care is in the hands of one local healthcare facility. The following portion of Live at 9 is sponsored by Sims Murphy Clinic. And to talk about whole spine care and their research efforts is Dr. Paul Puck. And here in the studio, I said, what is whole spine care? Welcome.
Well, I appreciate the opportunity to be here. And whole spine care can mean a lot of things to different folks, but to me, it's really looking at the patient and treating them comprehensively. It's a holistic view. It's not surgery. I'm a surgeon, but most of the patients I see in clinic aren't offered surgery. Often, I'll refer them to one of my colleagues who's a non-surgeon for care, and usually that's all it takes.
Wow, I mean, you hear about people pushing surgery, so it's really reassuring and heartwarming to hear you say that you seek that holistic view. So can you share an example where a whole spine care approach might lead to a different treatment plan than initially expected?
Well, yeah, I mean, for example, I saw a clinic this past Monday, and patients are often referred with an idea that they're going to need surgery. That's the only treatment.
Right.
They're feeling a lot of pain, and they figure that's the fastest approach to getting better. But I spend a lot of time actually counseling patients that really surgery is a last resort. And so I often refer them for a different type of treatment. And, at Sims Murphy, we have a lot of providers that are non-surgeons. In fact, there are probably more providers that are non-surgeons when it comes to therapists and physiatrists, for example, pain physicians that we have in our clinic who can treat patients adequately without surgery.
Okay, he's not just a neurosurgeon. You also do research. Tell us about the focus of your current work and how this can actually impact the future of spine care and neurosurgery. Wow.
Yeah, I've been involved in research for 20 years now. That's how long I've been in practice. And originally at the University of Michigan, but now here as well. And right now, it's mostly about clinical research, and that's different from basic or lab bench research, where it takes many years to translate into a clinical effect. So we're looking just at patient outcomes and mostly surgery, but also some non-surgical treatments, because we want to make sure that what we do is effective. The surgery sometimes has a little bit of a bad rap, where it doesn't work, and it almost sounds like we're harming patients, and obviously that's not something we want to do. But there are treatments surgically that aren't as effective. So the type of research we do is we're trying to figure out what is most effective, so when patients undergo a procedure, they have a good outcome.
Wow, okay, and we were able to put the information up on the screen. You can go to the website, sims-murphy.com, call the number 901-522-7700. There's even an email, and you can follow on Facebook to see more real-time information. Thank you so much, Dr. Paul. This was very interesting information that I had not heard yet.
Well, thank you. I appreciate the opportunity.
And the preceding portion of Live at 9 is sponsored by Sims Murphy Clinic. A heartbreaking story could have a happy ending with your help. Coming up next, our rescue roundup with the Horn Lake Animal Shelter and the 2-year-old Beagle mix in need of a home. Stay with us.